Making Disability Rights Real. Opening announcement. This is Making Disability Rights Real, Whakatūturu ngā Tika Hauātanga. Your narrator is Joe Gilfillan in the Parnell Studios of Blind Low Vision NZ. Indexing. The audio edition of this document is available in two formats. The DAISY CD edition has two levels. All the main section headings are on level 1. Sections under each of those headings are on level 2. The website edition has a separate MP3 file for all of the introductory materials, each of the sections, and the 3 appendices. There is also an MP3 file for each of the 5 groups into which endnotes have been arranged. Contents. Information. Introduction. The Disability Convention, Optional Protocol and the Independent Monitoring Mechanism. Executive Summary. Full list of recommendations. The experience of Maori. Pacific peoples. Article 4, General Obligations. Article 5, Equality and Non-Discrimination. Article 6, Women with Disabilities. Article 7, Children with Disabilities. Article 8, Awareness Raising. Article 9, Accessibility. Article 10, Right to Life. Article 11, Situations of Risk and Humanitarian Emergencies. Article 12, Equal Recognition Before the Law. Article 13, Access to Justice. Article 14, Liberty and Security of Person. Article 15, Freedom from torture or cruel, inhuman or degrading treatment or punishment. Article 16, Freedom from exploitation, violence and abuse. Article 17, Protecting the integrity of a person. Article 18, Liberty of movement and nationality. Article 19, Living independently and being included in the community. Article 20, Personal mobility. Article 21, Freedom of expression and opinion and access to information. Article 22, Respect for privacy. Article 23, Respect for home and the family. Article 24, Education. Article 25, Health. Article 26, Habilitation and Rehabilitation. Article 27, Work and Employment. Article 28, Adequate standard of living and social protection. Article 29, Participation in political and public life. Article 30, Participation in cultural life, recreation, leisure and sport. Article 31, Statistics and data collection. Article 32, International cooperation. Article 33, National implementation and monitoring. Contact information. Appendix 1, Glossary. Appendix 2, Examples of engagement with the Human Rights Commission's Mediation Service. Appendix 3, Endnotes. Closing announcement. Making Disability Rights Real, Whakatūturu ngā Tika Hauātanga. Third report of the Independent Monitoring Mechanism of the Convention on the Rights of Persons with Disabilities 2014 to 2019. The final report will be available in alternate and summarized formats, including an accessible online Word version, Braille, audio, Te Reo Māori, Easy Read and NZSL. June 2020. Introduction. New Zealand's Independent Monitoring Mechanism, IMM, is pleased to present our third Making Disability Rights Real report. We're reporting on the status of implementation of the United Nations Convention on the Rights of Persons with Disabilities, Disability Convention, in New Zealand. Designated under Article 33(2) of the Disability Convention, New Zealand's IMM partners are the Disabled People's Organisations, Dpo Coalition, the Ombudsman, and the New Zealand Human Rights Commission. Our role is to provide independent evaluation of the extent to which disabled New Zealanders are enjoying their universal human rights set out in the Disability Convention. The IMM identified 6 key themes in the lead-up to this report: education, housing, seclusion and restraint, data, access to information and communication, employment. These key themes are indicative of wider disparate outcomes between disabled people and their non-disabled peers. Improvements in these areas will have significant positive effects on disabled people's lives. The IMM conveyed these and other major concerns to the United Nations Committee on the Rights of Persons with Disabilities, Disability Committee, in December 2017, to assist the Disability Committee in forming the list of issues for the New Zealand Government to address in its combined second and third report on the Disability Convention. Making Disability Rights Real responds to the list of issues, but also extends beyond it to reflect disabled people's experiences in New Zealand. Included is a priority focus on Indigenous, Maori, disabled people and Pacific disabled peoples. A lack of disaggregated data makes it difficult to report the experiences of disabled Maori and Pacific peoples in relation to each individual article of the Disability Convention. For this reason, a global snapshot of the experiences of disabled Maori and Pacific peoples is presented at the beginning of the report. The IMM conducted a survey of disabled people and their supporters and held public consultation meetings to inform our report. The nationwide survey was available online in a range of accessible formats and languages, including Te Reo Māori, New Zealand Sign Language, Easy Read and Braille. Hui were held in 5 locations around the country, all of which were well attended. The IMM acknowledges change can take time. Positive progress has been made in the years since previous reports. In particular, we commend greater cross-government collaboration and improved participation of disabled people in the development of government policy. Some system reviews are also underway that may provide benefits for disabled people. However, the primary comment of the IMM must be on current lived realities of disabled New Zealanders. There is still a great deal of work to do. Disabled people remain far from enjoying the full range of human rights and fundamental freedoms reaffirmed in the Disability Convention. Many disabled people are experiencing poverty, exclusion, and lack of autonomy. Eliminating these huge disparities requires a quantum leap. We need to move from compensating for an inaccessible society founded on notions of disability as a deficit to recognizing disabled people as equal rights holders by actively working to create fully accessible communities. The IMM urges the government to mandate a systemic approach to explicitly integrating the Disability Convention into domestic law and to apply the appropriate resource in order to make this a reality. The recommendations in this report provide clear navigation to some critical starting points. We trust that they will serve as a springboard to accelerate meaningful advances for all disabled New Zealanders. Here follows a panel. The Making Disability Rights Real report relates to the period up until December 2019. Production of the report was being finalized at the beginning of 2020, which coincided with the unfolding of the global COVID-19 crisis. These unprecedented circumstances circumvented what was business as usual, delaying the report's launch. It is recognized that this pandemic has affected many lives throughout the world and, of course, here in New Zealand. The repercussions of such an event are felt more keenly by disabled people and vulnerable groups. It is with this in mind that the decision was made by the IMM not to include New Zealand's pandemic response in this report or as an addendum in Article 11. Instead, it was decided that COVID-19 needed a specifically themed report based on disabled people's experiences and the government's response to disability communities' needs during this time. Work on this report is underway. Report format. The report starts with a brief outline of the Disability Convention, optional protocol, and the IMM. It then provides an executive summary, including priority recommendations, reference to the experiences of disabled Maori and Pacific peoples, and a summary of the 6 key themes. The remainder of the report provides a detailed analysis of progress in the implementation of specific articles of the Disability Convention. Terminology. Many words and terms can be used to identify disability. For some, the term disabled people is a source of pride, identity and recognition that disabling barriers exist within society and not within individuals. For others, the term people with disabilities has the same meaning and is important to those who want to be recognized as a person before their disability. The Disability Convention uses the term persons with disabilities. In Te Ao Maori, the Maori world, tangata whaikaha may be used to refer to a disabled person. Endnote 1. The current consensus in New Zealand, based on the advice of the Disability Strategy Revision Reference Group, is to use the term disabled people. Endnote 2. We have used this terminology throughout our report. We acknowledge that members of the disabled community may wish to refer to themselves differently. The most important guiding principle is to remember to consider a person before considering their impairment. The Disability Convention, Optional Protocol and the Independent Monitoring Mechanism. Here there's a panel. Government must uphold its end of the Disability Convention. Make New Zealand 100% inclusive and accessible. Survey respondent. The Disability Convention. New Zealand signed the United Nations Convention on the Rights of Persons with Disabilities, Disability Convention, on 30 March 2007 and ratified it on 26 September 2008. The purpose of the Disability Convention is to promote, protect and ensure universal human rights and fundamental freedoms for disabled people and promote respect for their dignity. It recognizes the right of disabled people to make free and informed decisions about their own lives. It sets out in practical terms how the rights of disabled people can be realized. The Disability Convention places particular emphasis on reasonable accommodation, the concept of making appropriate changes or modifications to ensure disabled people have equal opportunities and rights. It also advocates universal design, the concept of designing products, environments, programs and services so they are usable by all people. The principles of the Disability Convention as specified in Article 3 are respect for inherent dignity, individual autonomy and independence of persons, non-discrimination, full and effective participation and inclusion in society, respect for difference and acceptance of disabled people as part of human diversity and humanity, equality of opportunity, accessibility, equality between men and women, and respect for the evolving capacities of disabled children and respect for the rights of disabled children to preserve their identities. 6 months after New Zealand signed the Disability Convention, the United Nations General Assembly adopted the Declaration on the Rights of Indigenous Peoples, UNDRIP, Endnote 3. New Zealand expressed its support for the UNDRIP in April 2010. While the declaration itself is not binding, many of the provisions reflect obligations set out in ratified conventions or covenants. In March 2019, Cabinet gave its approval for the Ministry of Maori Development to lead a process to develop a national plan of action on New Zealand's progress towards the objectives of the UNDRIP. The Disability Convention shares some common underlying human rights principles with both Te Tiriti Waitangi, Treaty of Waitangi, and UNDRIP. These include the importance of partnership, autonomy, close consultation, and full and effective participation. In monitoring the Disability Convention in New Zealand, we must also consider these intersecting rights and other relevant international conventions. Endnote 4. The Optional Protocol. On 4 November 2016, New Zealand ratified the Optional Protocol to the Disability Convention, the Optional Protocol. This gives disabled people who believe their rights have been denied a way to make a complaint directly to the Disability Committee. In support of this, the IMM has published Making Complaints to the United Nations Disability Committee, a Guide for New Zealanders. Endnote 5. Independent Monitoring Mechanism, IMM. Article 33 of the Disability Convention requires governments to establish an independent mechanism to promote, protect and monitor its implementation. The structure of New Zealand's IMM reflects the partnership approach underpinning the Disability Convention. The IMM partners are the Disabled People's Organisations, Dpo Coalition, a body reflecting the voice of disabled people in the monitoring process, the Ombudsman and the Human Rights Commission. The Human Rights Commission and the Ombudsman are established by statute. The purpose of the Human Rights Commission is to promote and protect the human rights of all New Zealanders. The role of the Ombudsman includes investigating the administrative conduct of public sector agencies, reviewing their decisions relating to requests for official information, acting as a national preventive mechanism under the Crimes of Torture Act 1989, recommending remedial action be taken where agencies have acted unfairly, acting as an appropriate authority under the Protected Disclosures Act 2000, and providing advice and guidance. The Dpo Coalition is made up of 7 organisations: Association of Blind Citizens of New Zealand Incorporated, Balance Aotearoa, Deaf Aotearoa, Disabled Persons Assembly New Zealand Incorporated, Kapo Maori Aotearoa New Zealand Incorporated, Muscular Dystrophy Association of New Zealand Incorporated, People First New Zealand Incorporated, Ngā Tangata Tuatahi. This arrangement reflects Article 4.3 of the Disability Convention, which provides that all decision-making processes relating to disabled people shall actively involve disabled people through their representative organisations, effectively encompassing the expression, "nothing about us without us." The IMM has published 2 earlier Making Disability Rights Real reports, which are available in a number of accessible formats. Endnote 6. Executive Summary. New Zealand has a mixed record when it comes to the rights of disabled people. Although we do some things well, there is still a great deal of work required to remove barriers stopping disabled people from participating in society on an equal basis. The IMM have identified 6 key themes that must be prioritised to ensure the realisation of the fundamental rights set out in the Disability Convention in New Zealand. It is also important that we highlight the experience of disabled Maori and Pacific peoples in our report. We have ranked the 6 key themes in order to make clear where the most urgent action is needed by the government. Red, for immediate attention. Amber, needs significant attention over the next 6 months. Yellow, needs attention over the next 12 months. The IMM believes that education, housing and seclusion and restraint are the most pressing issues for disabled people that the government must take urgent action on. In education, a generation of disabled people is being significantly negatively impacted and set up for poor lifelong outcomes. This is despite recent years of reform, which unfortunately has not been co-designed effectively with disabled people, nor has it addressed systemic concerns for inclusivity. Accessible housing is critical for disabled people to be healthy, safe and secure, and to participate in their communities. There are simply not enough suitable homes available for the people who need them. Seclusion and restraint continue to be used in secure health and disability facilities. While fewer people are affected by these practices than by inequities in housing and education, it continues to cause significant harm. Of particular concern is the disproportionate use of seclusion and restraint for Maori. While the other key themes are also vital, we urge the government to immediately address the severe inequalities created by the current education and housing system and the ongoing use of seclusion and restraint. Education. Red. Recommendation. Introduce an enforceable right to inclusive education as a key element of the legislative framework and ensures resource to attain equitable access. Key recommendation, build co-design into every stage of the education reform process. Housing. Red. Key recommendation: implement legislation requiring all newly built housing to conform to universal design standards. Also refer Article 9. Seclusion and Restraint. Red. Key recommendation: strengthens its commitment to reduction of rates of restraint of persons with disabilities and the rapid reduction towards elimination of use of seclusion in secure health and disability facilities through robust, achievable and time-bound policies. Data. Amber. Key recommendation: restart the disability survey following each census, commencing with the 2023 census. Access to information and communication. Yellow. Key recommendation: enable disabled people to communicate more effectively with government agencies by increasing the number of accessible formats available so that disabled people can express their views in New Zealand Sign Language and use Braille, easy read and audio formats to engage fully. Employment. Yellow. Key recommendation: develop a comprehensive rights-based national disability employment strategy. The IMM expects the response from the government to the 6 priority areas to recognise the unique needs of marginalised groups, including disabled Maori and Pacific peoples. Further examination of the key themes and a full list of recommendations are set out in the following sections. Key themes. Maori. It is the IMM's view that the human rights of Maori, New Zealand's indigenous people, are not being fully realised as set out in the Disability Convention, United Nations Declaration of the Rights of Indigenous People, UNDRIP, and New Zealand's founding constitutional document, Te Tiriti o Waitangi, Treaty of Waitangi. Compared to non-Maori, Maori have higher rates of disability, poverty, suicide and unemployment, and they have lower life expectancy. Tangata whaikaha, disabled Maori, are further marginalised, faring worse than their non-disabled Maori peers, with lower labour force participation and lower rates of educational achievement. The IMM is concerned that barriers to full citizenship are still in place, which need to be removed in order to address these inequities. Maori need to be able to access the right resources to allow self-determined solutions to address historical and persistent inequalities, and to be involved in decision and policy-making processes. There are some initiatives in place to tackle entrenched inequities, including Whaia Ta'au Marama, 2018 to 2022, the Māori Disability Action Plan. One of its aims is to increase tangata whaikaha participation in the development of health and disability services and increase provision of disability support services that are responsive to Te Ao Māori. Y2575 Health Services and Outcomes Kaupapa Inquiry, Y2575, has also highlighted the lack of robust data around Māori disability issues by the claims lodged with the Waitangi Tribunal. In order to monitor outcomes of tangata whaikaha effectively, the IMM needs quality disaggregated data to ensure tangata whaikaha can enjoy their human rights on an equal basis with others. Pacific peoples. The IMM is aware that Pacific disabled people share many experiences with tangata whaikaha. Cultural differences and language barriers can preclude Pacific disabled people and their families from being able to navigate often complex processes to access appropriate health and support services. Low cultural competence in many service providers also affects the ability of Pacific disabled peoples to fully participate in community and public life on an equal basis with others. However, progress is being made, including the updating of the Whaewa Ora 2016 to 2021 National Pasifika Disability Plan. It is hoped that this plan will enhance engagement with Pacific disabled peoples and enable people to access the services they need to realise their human rights. Lack of disaggregated data continues to be an area of concern for the IMM, as in its absence it is difficult to monitor progress of the realisation of the rights of Pacific disabled peoples. Education. Refer Article 24. An enforceable right to inclusive education for students with disabilities is a key priority for the IMM. The Education Act 1989 protects the right of all people to enrol and receive education at any school. However, the current legislative framework does not explicitly incorporate inclusive education or reasonable accommodation principles. There are a number of challenges, including a lack of appropriate legislation, teacher training, data collection, and funding. Many disabled people and advocates are disillusioned with the lack of practical action regarding inclusivity in education. Small-scale interventions, such as better coordination of existing services and supports, additional support staff, and spending on existing property, are positive steps but do not go far enough. Multiple aspects of the modern teaching and learning environment in New Zealand must be addressed so that all students can shine. Housing. Refer Article 19. It is crucial for disabled people to be able to live where they choose and have the support they need. While there is nothing in New Zealand law preventing disabled people from living in a place of their choosing, the IMM is concerned that there are affordability, accessibility and support issues that often create significant barriers to disabled people being able to realise this right. There is also a long waiting list for government-owned housing stock, much of which will not meet the needs of disabled residents. Private landlords are often unwilling to have modifications made to their properties. Seclusion, Endnote 7, and Restraint. Refer Articles 15, 24 and 25. The IMM is concerned at the continued use of seclusion and restraint practices in New Zealand prisons and healthcare facilities. Although there are often alternative options available to manage challenging behaviour, seclusion and restraint are not always used, only as a last resort. We have particular concerns about prisoners in intervention and support units, ISU, previously known as at-risk units, where prisoners are essentially held in solitary confinement, alone in their cell up to 22 to 24 hours a day, watched on camera, including when toileting. The physical and material conditions in these units, where vulnerable prisoners are housed, are identical to those in segregation units and breach international standards. Mandela Rule 45.2 explicitly prohibits the placement of prisoners with physical or mental disabilities in solitary confinement. Endnote 8. Seclusion and restraint are sometimes used in health and disability places of detention. The Health Quality and Safety Commission is working with Te Po o Te Whakaaro Nui, Endnote 9, and district health boards to reduce the use of seclusion and restraint with its initiative Zero Seclusion towards eliminating seclusion by 2020. This project sets an aspirational target that is unlikely to be achieved in its set time frame. Data. Refer Article 31. The IMM is aware that there are significant gaps in disaggregated disability data in New Zealand, including in housing, education, employment and intersectional issues. This is compounded by the lack of a commonly accepted definition of disability by public and private interests, making it difficult to do any kind of comparison between services. The absence of useful data has a negative impact on the quality of government policy and decision-making and the ability of service providers to target services for disabled people. It also makes it difficult to accurately measure New Zealand's progress in implementing the rights in the Disability Convention. The government is committed to working with agencies and experts to collect data for all 29 measures identified in the New Zealand Disability Strategy 2016 to 2026. The Disability Data and Evidence Working Group was set up in 2015 with a focus on gathering data and evidence in order to develop effective policy and services to meet the identified needs of disabled people. Access to information and communication. Refer Articles 9 and 21. Disabled people have the right to express their opinions and to seek, receive and share information in forms that they can understand and use. Missing out on information and being unable to express opinions prevent disabled people from participating fully as citizens and limit their ability to interact with both government and wider society independently. It is the IMM's view that the whole-of-government approach and legislation are required to ensure accessibility in the two-way flow of information, including government information and information in the broader public arena. The government has indicated that it hopes the introduction of its Accessibility Charter will provide increased access to information, with a focus on increasing provision of government information in easy read, Braille, New Zealand Sign Language and audio formats. It is also working with stakeholders to consider the possibility of introducing accessibility legislation to improve access to information. Employment. Refer Article 27. That IMM is concerned that disabled people experience significant inequities in labour force participation, employment rates and income. This is due to factors such as employer bias, inaccessibility and inflexible support policies. Being unemployed or underemployed constrains other life choices and impacts on the right to an adequate standard of living. Employment not only has a positive impact on disabled people's lives, but there would be fiscal benefit of $1.45 billion per year if the participation of disabled people in the labour market was equalised. Endnote 10. However, investment in labour market strategies in New Zealand remains low. There are positive initiatives underway in the public sector, such as internships for disabled people, an emphasis on consistent collection of data, and toolkits to build employer knowledge and confidence, and there is also some interest from the private sector. However, current initiatives are yet to yield significant or reliably durable shifts in employment outcomes, indicating the need to maintain focus on and resources for improving employment opportunities. Serious consideration to instituting temporary special measures or affirmative actions is also warranted. The IMM supports the creation of a disability employment strategy to bring coherence across the actions of many stakeholders in employment. Other areas of concern. It is not feasible to present all the areas of progress in disability rights in New Zealand in this report, nor can this report comprehensively document each and every one of the many barriers that continue to prevent disabled people living full and barrier-free lives in New Zealand. In addition to the IMM's 6 key areas of concerns, there are a number of other issues consistently raised regarding the implementation and full realisation of the Disability Convention in New Zealand. To capture this and give an opportunity for disabled people to voice their concerns and issues, the IMM held a series of hui around New Zealand in 2019. We also conducted an online survey. This feedback has helped inform the present report. Full list of recommendations. Maori. The IMM recommends that the government 1. Take immediate steps to progress a mechanism by which the voice of tangata whaikaha can be formally included in all disability-related policy and legislative development, and any Crown Māori partnership initiatives. This recommendation reflects and supports Recommendation 11 of the IMM UNDRIP's report regarding the implementation of the UN Declaration on the Rights of Indigenous Peoples in Aotearoa, New Zealand, June 2018. Endnote 11. 2. Act to implement Recommendations 3 and 6 of the IMM UNDRIP's report regarding the implementation of the UN Declaration on the Rights of Indigenous Peoples in Aotearoa, New Zealand, June 2018. Endnote 12. 3. In addressing poorer socio-economic outcomes for Maori, specifically identify and address the disproportionate impacts of these inequities on tangata whaikaha. Pacific peoples. The IMM recommends that the government 4. In addressing poorer socio-economic outcomes for Pacific peoples, specifically identify and address the disproportionate impacts of these inequities on Pacific disabled peoples. 5. Continue to support the implementation of Whaiva Ora 2016 to 2021 National Pasifika Disability Plan and the role of the Whaiva Ora Leadership Group. 6. Support and resource the further development of an autonomous Pacific disabled peoples-led organisation through which their voice can be formally included in all disability-related policy and legislative development and in the co-design of an extended range and choice of support options. Article 4. General Obligations. The IMM recommends that the government 7. Include reference to the Disability Convention in all relevant future legislation to promote awareness and understanding of the Disability Convention and ensure that legislation is fully compliant with the obligations set out in the Disability Convention. 8. Work with disabled people to codify structures, timeframes, processes and resources that would enact genuine partnership with disabled people and to facilitate co-governance, including co-design, co-production and co-evaluation with disabled people of all legislation, policies, procedures and other decision-making processes affecting disabled people. 9. Take all necessary steps to ensure adequate resource availability for a diverse range of disabled people's representative organisations. Endnote 13. Article 5. Equality and non-discrimination. The IMM recommends that the government 10. Amend the Human Rights Act 1993 with a view to strengthening disabled people's right to non-discrimination, including A. Removing or reducing disability-related exemptions. B. Introducing an explicit definition of reasonable accommodation consistent with the meaning provided in Article 2 of the Disability Convention and General Comment 6 on Article 5, Endnote 14. And C. Creating an explicit duty of reasonable accommodation. 11. As a matter of urgency, conduct an audit of existing legislation for conformity with the Disability Convention, specifically the right to non-discrimination and equality before the law, and report its findings publicly, specifically highlighting non-compliant legislation. 12. Develop with disabled people a disability discrimination impact assessment tool or framework and apply this whenever new legislation is developed or current legislation amended to ensure systemic processes for harmonizing all legislation with the Disability Convention and eliminating any discriminatory provisions. Article 6. Women with disabilities. The IMM recommends that the government 13. Actively consult disabled women and girls where appropriate in legislative and policy development, decision-making, program monitoring and violence prevention measures. 14. Strengthen intersectional approaches that integrate disability perspectives within gender equity initiatives and gender perspectives within disability initiatives, including the collection and analysis of data. 15. In partnership with disabled women, conduct accessibility audits of violence prevention and response services, including those provided by third parties, to ensure that they are inclusive and accessible and staff have access to appropriate training. 16. Ensure that all women's health and sexual and reproductive services, including those provided by third parties, are provided in accessible facilities and information on these services is provided in accessible formats. 17. Institute temporary special measures, affirmative action, aimed at accelerating equitable participation of disabled women in employment. Article 7. Children with disabilities. The IMM recommends that the government 18. Collect more comprehensive disaggregated data for disabled young people to inform effective early intervention, especially in the fields of education, care and protection, and youth justice. 19. Continue to focus on putting mechanisms in place to put the child's voice at the centre of policy development. Article 8. Awareness raising. The IMM recommends that the government 20. Initiate a co-designed nationwide campaign that A. Promotes disabled people's rights and dignity, including profiling the value of diversity. B. Counters negative perceptions about the value of disabled people's lives that have been highlighted, promulgated, through debates relating to the End of Life Choice Act 2019 and antenatal screening. And C. Urgently and specifically counteracts public perceptions associating psychosocial disability and violence. 21. Include disabled people-developed disability inclusion content in school curricula and tertiary-level training, particularly, but not limited to, mandatory training for all teachers and others in professions that work directly with disabled people. 22. Provide additional resources to ensure that anti-bullying prevention campaigns fully involve and meet the needs of disabled people. 23. Ensure that, in considering the introduction of expanded hate speech or new hate crime legislation, disability-related hate speech or crime is included. 24. Provide disabled people-led training through the State Services Commission on the Disability Convention for Government Personnel. Article 9. Accessibility. The IMM recommends that the government 25. Develop and agree on comprehensive definitions of universal design and accessibility and use these definitions consistently. 26. Update the New Zealand Standard NZS 4121:2001 and develop a comprehensive range of compatible accessibility standards to cover all aspects of community and civic access. 27. Ensure accessibility and universal design be implemented in all A. New housing developments, B. Public spaces, C. Transportation and ticketing systems, D. Shared use spaces, and E. Technologies and communications. 28. Implement robust strategies and timelines to upgrade existing public infrastructure to meet best practice accessible design standards. 29. Implement systems to require regular monitoring and/or auditing against minimum standards of accessibility of all publicly accessible buildings, workplaces, civic or recreational areas, and public services. 30. Co-design accessible systems with disabled people, taking particular account of marginalised groups such as children. Article 10. Right to life. The IMM recommends that the government 31. Ensure the potential negative impact that any legislation permitting assisted dying may have on disabled people is taken into consideration. 32. Ensure through effective monitoring that, should the End of Life Choice Act 2019 come into force, it does not have a disproportionate impact on the right to life for disabled people. Article 11. Situations of risk and humanitarian emergencies. The IMM recommends that the government 33. Continue to work with the Dpo Coalition on Disability Inclusive Disaster Risk Reduction, DIDRR, and that the work should expand to provide a comprehensive response to a range of humanitarian risk and natural disasters. 34. Develop and promote schemes that proactively support increasing resilience for disabled individuals, families, groups and communities to mitigate the risks and impacts of natural disasters or other humanitarian emergencies. Article 12. Equal recognition before the law. The IMM recommends that the government 35. Repeal and replace any legislation allowing forced interventions that are based on and reinforce negative or deficient notions of disabled people and permit compulsory treatment interventions including A. Mental Health, Compulsory Assessment and Treatment Act 1992, noting that this is already committed to in the Disability Action Plan. B. Intellectual Disability, Compulsory Care and Rehabilitation Act 2003. C. Substance Addiction, Compulsory Assessment and Treatment Act 2017, and D. Any sections of the Oranga Tamariki Act 1989, Children's and Young People's Wellbeing Act 1989 that enable arbitrary detention, solitary confinement, restraint, or actions that may constitute cruel, inhuman, or degrading treatment or punishment. 36. Request that the Law Commission's review of adults with impaired decision-making capacity, A. is co-designed with disabled people, B. is informed by a human rights approach that recognizes universal legal rights to access support to make decisions and that maximizes participation, C. reflects an understanding of substitute decision-making as an option only of last resort after all supported decision-making options are exhausted, and that any substitute decision should be based on the best interpretation of the person's rights, will, and preference. D. enshrines the importance of regular reviews and robust monitoring mechanisms. And E. considers a unified framework that could be applied irrespective of the reason for temporary or longer-term decision-making substitution. 37. Ensure disabled people and their representative organizations have sustainable resources to lead the development of supported decision-making capability for disabled people, whānau, and duty-bearers, such as the health and disability workforce, legal profession, and financial institutions. Article 13. Access to Justice. The IMM recommends that the government 38. Undertake a strategic review of the justice system to ensure that it is accessible and fit for purpose for disabled people to ensure equal access. Recommended actions include, but are not limited to, A. Improving data collection by the Ministry of Justice and the courts. B. Undertaking mandatory and funded accessibility audits of all courts and Ministry of Justice and Department of Corrections facilities. C. Ensuring information about the justice sector is fully accessible, both in terms of its individual components and the various journeys that an individual may take through the justice system as a whole. D. Providing further training on disability rights and accessibility within the justice sector, including the effects of multiple discrimination. E. Encouraging and funding a significant increase in legal expertise on disability and human rights. F. Establishing and funding an independent advocacy service for disabled people. G. Reviewing any barriers that affect lawyers in private practice responding to disabled clients. H. Increasing resources for community law providers that provide disability-related legal interventions. And I. Increasing and understanding of neurodisability within the justice system and developing specific cognitive and communication responses to people with neurological impairments. Article 14. Liberty and security of person. The IMM recommends that the government 39. Implement the formal recommendation made in the Inquiry into Mental Health and Addiction to repeal and replace the Mental Health Compulsory Assessment and Treatment Act 1992 in partnership with people with experience of mental distress, including wide consultation with tangata whaikaha without delay. 40. Action paragraphs 33 and 34 of the Disability Committee's concluding observations to eliminate detention in medical facilities on the basis of actual or perceived disability, provide treatment only on the basis of free and informed consent, and eliminate the use of seclusion and restraint in medical facilities. 41. Ensure that the review required by Section 120 of the Substance Addiction, Compulsory Assessment and Treatment Act 2017 is implemented comprehensively. Article 15. Freedom from torture or cruel, inhuman or degrading treatment or punishment. The IMM recommends that the government 42. Strengthens its commitment to reduction of rates of restraint of persons with disabilities and the rapid reduction towards elimination of use of seclusion in secure health and disability facilities through robust, achievable and time-bound policies. 43. Pending elimination of these practices, require district health boards to regularly release annual statistics indicating performance against these policies, including reporting comprehensive data relating to long-term stays in seclusion. Article 16. Freedom from exploitation, violence and abuse. The IMM recommends that the government 44. Develop a range of initiatives to ensure that disabled people experience the same protection from domestic and other forms of violence as non-disabled people, and that agencies identify and appropriately respond to abuse and violence directed at disabled people, including by A. Ensuring all government-funded domestic and anti-violence programs include accessible material for disabled people. B. Increasing awareness of abuse experienced by disabled people and of the mechanisms to address it, and providing sustainable funding for disabled people-led organizations working in this area. C. Increasing resourcing for disabled people-led initiatives to ensure there are better systems of recognition, prevention and rapid response to abuse. D. Ensuring that data collection by the police enables disaggregated data to be collected to allow for accurate recording and analysis of violence and abuse toward disabled people. And E. Ensuring people subject to compulsory detention on the basis of disability have ready access to trained advocates free of charge, and ensuring advocates cannot be prevented from visiting clients on demand to act as witnesses to situations and conditions. Article 17. Protecting the integrity of the person. The IMM recommends that the government 45. Enact legislation to prohibit the use of sterilization or any other non-therapeutic medical procedure on disabled children and disabled adults without their prior, fully informed and free consent. 46. Improve methods of collecting and reporting on statistics on sterilization and other non-therapeutic medical procedures in New Zealand, whilst ensuring all data collection is anonymized in such a way to prevent identification. Article 18. Liberty of movement and nationality. The IMM recommends that the government 47. Review relevant legislation and policy to ensure that disabled people do not experience additional barriers over and above others when applying for entry into New Zealand, including but not limited to A. Ensuring that immigration officers have regard to the Disability Convention when making decisions under the Immigration Act, and B. Repealing Section 392 of the Immigration Act to enable the Human Rights Commission to receive complaints about immigration matters. 48. Work with disabled people to create immigration instructions that fulfill the government's obligations under the Disability Convention and the Disability Strategy. Article 19. Living independently and being included in the community. The IMM recommends that the government 49. Implement legislation requiring all newly built housing to conform to universal design standards. Refer also Article 9. 50. Require kāinga ora homes and communities to A. Adopt a comprehensive definition of universal design. B. Commit immediately to a policy of implementing universal design in all new housing builds across all housing types. C. Commit to replacing or retrofitting all existing housing stock to universal design standards over 10 years. D. Design a range of accessible specifications for each housing type available, that is, consistent with NZS 4121:2001 design standards. E. Implement a comprehensive accessibility audit of its housing stock. F. Commit to ensuring that a representative proportion of their housing stock is retrofitted to meet accessibility standards, that is, per the accessible specifications developed above, as opposed to solely bespoke customizations. The proportion of accessible houses should, at minimum, be the proportion of kāinga ora tenants with an impairment, and G. Increase the tenure for any disabled tenants requiring bespoke modifications to ensure they can stay in homes that have been modified to their specifications. 51. Revise and/or expand all disability-related equipment and vehicle funding schemes to ensure that disabled people have access to the equipment they need to live independently and access their community. 52. Fully implement the recommendations of the 2008 Social Services Select Committee report, Inquiry into the Quality of Care and Service Provisions for People with Disabilities, Endnote 15, to reduce the number of disabled people forced to live in rest homes. 53. Introduce accessibility legislation requiring all community services and facilities to be accessible by disabled people and explicitly stating what is expected of all service providers. 54. As a matter of urgency, develop sustainable and equitable funding models so that all disabled people, irrespective of cause, can access flexible and integrated supports that facilitate independent living and full participation in the community. 55. Ensure that central government, local government and any other housing providers determine the numbers and types of accessible housing in such a way that they can be assessed against the community's need. 56. Put more emphasis on the need for housing to be designed and built with accessibility in mind and ensure disabled people have increased and quick access to sufficient housing modification funds to allow them to move about their own homes safely. Article 20. Personal mobility. The IMM recommends that the government 57. Urgently review and extend investment in subsidised taxi and other travel schemes for disabled people unable to access public transports so they can secure consistent and transferable 24/7 access to a range of transport options nationwide. 58. Urge local governments to embed accessibility requirements within its procurement processes for public transport to ensure that disabled people have equitable access to public transport. 59. Require that all taxi fleets must have all, or at least a substantial proportion of, vehicles that are wheelchair accessible and ensure those vehicles are available in proportion to the general fleet. 60. Set expectation and implementation targets for territorial authorities to ensure that their roads, transport infrastructure and pedestrian routes are constructed, retrofitted and maintained to meet accessibility standards. 61. Equalise the funding for mobility training and equipment for all disabled people, regardless of the cause of impairment, thus removing the difference between Ministry of Health and Accident Compensation Corporation, ACC, clients. 62. Provide additional investment into research and development of mobility aids and to develop or import innovative mobility aids. Article 21. Freedom of expression and opinion and access to information. The IMM recommends that the government 63. Expand the Accessibility Charter to include local authorities and district health boards. 64. Pass accessibility legislation requiring private providers of information, websites and mass media to include accessibility. 65. Enable disabled people to communicate more effectively with government agencies by increasing the number of accessible formats available so that disabled people can express their views in New Zealand Sign Language and use Braille, Easy Read and audio formats to engage fully. 66. Increase access to information and communication for disabled Maori, including increased provision of interpreting, captioning, audio description and easy read in Te Reo Māori. Article 22. Respect for privacy. The IMM recommends that the government 67. Conduct an audit and/or situational analysis of disabled people's experiences with privacy and information sharing. 68. Instruct all public sector agencies to ensure that any personal information they gather or hold about disabled people is secure, accessible, and constitutes the least amount of intrusion necessary. 69. Ensure public sector agencies and service providers understand their responsibilities under the Privacy Act 1993 and the Health Information Privacy Code, and be required to demonstrate they have robust training and privacy policies in place in order to receive government funding, particularly in cases where services are outsourced to third parties. This should include improved complaints procedures and assurances that information provided to complainants will be sent in accessible formats. 70. Instruct public sector agencies to provide all official documents in accessible formats with the option to complete them online using New Zealand Sign Language or with the assistance of appropriately trained staff. 71. Ensure that the amount of medical data that disabled people are required to provide in order to access services and supports is reviewed and reconciled with a view to reducing repetition, only obtaining necessary information, and ensuring secure data sharing mechanisms are in place. Article 23. Respect for home and the family. The IMM recommends that the government 72. Ensure disabled people's whānau receive financial and other supports necessary to care for their children, including, but not limited to, assistance at home, accessible parenting courses, and access to communication support such as New Zealand Sign Language interpreters. 73. Ensure disabled children's right to remain in the family home is protected through the provision of financial and other support to their families. 74. Provide to the IMM evidence that confirms no children are being uplifted from a home situation solely on the basis of disability of any member of the family or whānau or because of inadequate support. 75. Review the Adoption Act 1955 to ensure conformity with the Disability Convention. In particular, act without delay on earlier IMM recommendations to review Sections 8 and 11 of the Adoption Act to prohibit adoptions being made on the basis of disability alone or without consent of the parent. 76. Ensure that court personnel and those furnishing reports to them are provided with training about disability rights and the Disability Convention to ensure a human rights approach is adhered to. Article 24. Education. The IMM recommends that the government, 77, urgently introduce an enforceable right to inclusive education as a key element of the legislative framework and ensures resources to attain equitable access. 78. Build co-design into every stage of the education reform process. 79. Establish a reference group including disabled people via their representative organisations and reporting directly to the Minister or Ministers of Education to work on key education initiatives. 80. Review as a priority existing learner support funding models to ensure they provide meaningful support to enable all disabled students to participate equitably in education. 81. Ensure that the implementation of proposed complaint and dispute resolution panels include co-design with disabled people and whānau to ensure there will be timely and effective responses where there is a lack of reasonable communication as well as timely and effective remedy and redress. 82. Ensure there is safe and secure data and information sharing from a rights-based perspective. 83. Introduce and bolster meaningful training, development and progression for teachers and education leaders to ensure they are welcoming and inclusive of diverse children, including those with neurodisabilities or invisible disabilities. Article 25. Health. The IMM recommends that the government 84. Reform the Public Health and Disability Act 2000 to introduce provisions to ensure disabled people are meaningfully represented in governance roles across the health and disability system. 85. Advance innovative models of funding for integrated and flexible disability support and provide adequate resourcing of those models so that disabled people are able to enjoy the highest attainable standard of health, including but not limited to accelerating accessible access nationally to an enabling good lives approach. 86. Take definitive action to clarify the expectation on district health boards to provide disability-related supports, particularly in relation to Section 22(1)(c) and D of the Public Health and Disability Act 2000. 87. Implement earlier recommendations of the IMM to address inequities in life expectancy for disabled people, particularly people with intellectual or learning and psychosocial disabilities. Work with disabled people and their representative organizations to establish a comprehensive health improvement and monitoring program. 88. Act on the outcomes of Phase 1 and upcoming hearings of the Y2575 Health Services and Outcomes Kaupapa Inquiry. 89. Ensure that the development of initiatives targeting equitable health service access for disabled people are co-designed with disabled people. 90. Ensure a co-design process with people with psychosocial experiences in the implementation of the recommendations of the Hauātanga report of the Government Inquiry into Mental Health and Addiction, Endnote 16, and ensure that they are appropriately resourced to carry out this work. Article 26. Habilitation and Rehabilitation. The IMM recommends that the Government 91. Act on earlier IMM recommendations to address disparities between habilitation and rehabilitation services funded by ACC and those services funded by other government agencies to eliminate inequities in level and standard of services. Particular consideration should be given to disabled people born with an impairment and those who acquired an impairment without an accident. 92. Ensure all disabled people have access to high-quality habilitation services and other preventive measures to proactively address and mitigate progression of impairments with a view to maintaining maximum independence, inclusion and participation in all aspects of life. 93. Broaden access to and adequately resource a comprehensive range of habilitation and rehabilitation services to enable disabled people to attain and maintain maximum independence, full physical, mental, social and vocational ability, and full inclusion and participation in all aspects of life. Article 27. Work and Employment. The IMM recommends that the Government, 94, consider the development of a more comprehensive rights-based national disability-specific employment strategy that A. Provides for solutions by tangata whaikaha for tangata whaikaha. B. Proactively addresses disabled people's inequitable employment outcomes. C. Is co-designed by disabled people and employers. D. Facilitates local innovation and ownership. E. Lifts investment. And F. Includes time-specific milestones, measurable actions, and a monitoring framework. 95. Pending the fuller review referred to in Recommendation 10, consider an immediate amendment of the Human Rights Act 1993 to explicitly define reasonable accommodation in an employment context, create a positive duty for its provision, and provide guidance for interpretation of undue burden, informed by Article 2 of the Disability Convention and General Comment 6 on equality and non-discrimination. 96. Initiate affirmative actions or temporary special measures to increase the employment of disabled people within the public service. This could include establishing a quota or target, but could also include the following actions. A. Undertake to shortlist and interview all appropriately qualified disabled applicants. B. Explore ways to incentivize investment by employers in universal design and accessible infrastructures, for example, tax rebates or concessions. And C. Consider how government procurement processes or investments such as the Provincial Growth Fund could positively contribute to disabled people's employment by requiring vendors or recipients to explicitly demonstrate how their initiative is inclusive of and accessible to disabled people. 97. Implement the 2014 recommendation to amend the Minimum Wage Act 1983 to eliminate minimum wage exemption permits. Article 28. Adequate standard of living and social protection. The IMM recommends that the government, 98, adopt the disability-related recommendations of Whakamana Tangata, the report of the Welfare Expert Advisory Group. The IMM endorses the report's stated purpose for a welfare system and encourages the holistic implementation of all recommendations as a matter of urgency, but specifically the following recommendations relating to housing availability and affordability and income adequacy. Endnote 17. A. Increase, as soon as possible, overall income support to levels adequate for meaningful participation in the community as defined by the minimum income standard, which reflects different family circumstances, for example, children, disabilities and regional area, and maintain this level of support through appropriate indexation. B. Urgently expand and accelerate government efforts to substantially increase public housing on an industrial scale and continue urgent efforts to end homelessness. C. Increase the range of home ownership and tenure options for people on low and low to middle incomes. D. Increase the capacity of third sector community-based housing providers. E. Develop and enact laws and regulations to ensure healthy homes and housing security, decent standards of housing quality, universal design, and accessibility. F. Subsidize housing costs for people on low incomes, in addition to raising main benefit rates to provide an adequate income, and ensure the combination of changes to housing support and abatement rates make households better off. G. Improve access to affordable, suitable housing support for people on low and low to middle incomes, including a range of affordable home ownership products and papakainga housing. H. Improve the health and well-being of people with health conditions and disabilities, along with carers of people with health conditions and disabilities who interact with the welfare system by providing financial support that is adequate to live a life with dignity and is equitable across the social sector. Implementing evidence-based approaches to support engagement in good, suitable work and the community where this is possible. Implementing strategies to prevent work-limiting health conditions and disabilities. I. Include in the scope of the New Zealand Health and Disability System Review the relationship between the health and disability system and the accident compensation scheme and how the relationship between these and the welfare system could be changed to improve outcomes for people with health conditions and disabilities and carers. Article 29. Participation in political and public life. The IMM recommends that the government 99. Review the parameters for disqualification of voters subject to the Mental Health, Compulsory Assessment and Treatment Act 1992 and the Intellectual Disability, Compulsory Care and Rehabilitation Act 2003 to ensure conformity with the Disability Convention. 100. Implement legislation and other measures to increase accessibility of election processes for disabled people co-designed with disabled people. 101. Work closely with disabled people and the Electoral Commission to ensure that information about local and general elections can be provided in accessible formats and that the necessary supports are in place to ensure that there is not a disproportionate exclusion from voting of people with an intellectual impairment. 102. Review the support for disabled candidates and electoral processes and resource and provide reasonable accommodation at both local and central government levels. Article 30. Participation in cultural life, recreation, leisure and sport. The IMM recommends that the government 103. Take steps to mandate that publicly funded sporting and cultural initiatives and facilities, including those provided in partnership with local government, are made accessible as a requirement of standard procurement procedures and existing facilities to best practice accessibility standards. 104. Ensure that all tourist facilities, hotels and other accommodation providers, public attractions and sporting and cultural facilities are required to provide detailed information on their websites outlining the accessibility features of the venue and/or service. 105. Require all sporting, cultural, entertainment and/or recreational facilities to make provision for accessibility features proportionate to the prevalence of those access needs in the community. 106. Introduce a discount scheme for disabled people's companion tickets to enable disabled people to take a support carer to events and performances at a reduced cost. 107. Provide increased funding to train and employ trilingual interpreters and audio describers and to make their services available at civic and cultural events. This will require developing a strategy to build a pool of trilingual personnel. 108. Introduce legislation to require an increase in the amount of captioning and audio description on New Zealand television, including the provision of captions and audio description for on-demand content, including content provided in Te Reo Maori. 109. Require sporting events to provide a live commentary for blind patrons, either generated from within the stadium or via standard radio stations, which must be live and not delayed. 110. Introduce new legislation requiring film distributors and producers to include accessibility features, including captions and audio description, particularly when these have been made available in other parts of the world. 111. Increase funding for sporting bodies to make their activities and facilities fully inclusive of disabled sports people. Article 31. Statistics and Data Collection. The IMM recommends that the government 112. From 2023, restart the disability survey following each census, commencing with the 2023 census. 113. Continue to introduce disability data collection in all general household surveys conducted by Statistics New Zealand. 114. Continue to promote the benefits and advise on the limitations of the Washington Group short set of questions on disability in order to encourage the creation of a consistent cross-agency data set. 115. Continue work with disabled people and representative organizations to ensure that census completion is barrier-free for disabled people so they can engage as they choose with independence, confidence and dignity. Article 32. International Cooperation. The IMM recommends that the government 116. Continue its commitment to and consolidate its partnership with the Pacific Disability Forum. 117. Funded disabled people's participation in initiatives of international cooperation, including significant international disability events such as the Global Disability Summits, the annual conference of state parties, and at the United Nations when New Zealand is reviewed against the Disability Convention by the Disability Committee. 118. Build New Zealand's Pacific aid programs and initiatives so they're accessible to and inclusive of the needs of the disabled people in the region. Article 33. National Implementation and Monitoring. The IMM recommends that the government 119. Create a transparent mechanism to demonstrate that it makes substantive and meaningful changes in response to IMM recommendations. 120. Work with the IMM to explore how to formalize increased diversity to reflect the groups detailed in General Comment 7, Endnote 18.